We appreciate you watching tonight here on OpenLine. It is Ask the Expert night if you are just tuning in. We're talking with endodontist Dr. Richard Horwat from Bluegrass Endodontics, and I know a couple of you are on the line with us right now, so we're going to go straight to the calls. I believe Penny is on the line with us right now. Penny, good evening, and do you have a question or a comment for Dr. Horwat?
I've got a question.
Okay.
When I go to the dentist, I'm a gagger, and they have to use the spray to numb my mouth. Is it dangerous for your system, or is it okay?
It is okay. It numbs your. It does a good job as well. I forget the name of the topical that is. I think it's something called benzocaine.
Yes.
It is benzocaine. See, I can't even remember what it causes. There is something that it causes. I think it's something called methemoglobinemia. Don't quote me on that, but it has to do with something that it can do to your blood flow. It's a very, very rare side effect, but it can cause that. I forget what it's called. If you have the time to go to your computer to look up methemoglobinemia, that's one heck of a word.
I was going to say that. When you said don't quote me on that, I'm like, I couldn't even spell it to quote you.
I know. I'm pretty sure that that's what it causes, and I know that they were having concerns that particular types of anesthetic cause that. I know that when I had done the research in it, that the benzocaine, the topical applied to your throat, was the main one that causes that. And I don't even remember what the disorder is. In fact, if I'm pretty sure that what the disorder is it's a lack of your blood to be able to carry oxygen. And so,
okay. Does it have like a steroid in it? Because I went to the doctor like the day after, and they said that my liver was up, and then I went back 2 weeks later, and it was up. My liver was okay, and they was wondering what that spray, if it had it.
I don't believe it has any type of steroid in there. Steroids, for the most part, there's so many different kinds of steroids, but they're for the most part anti-inflammatories. And I don't believe that there's any type of anti-inflammation going on with that spray. I could be incorrect on that. You might want to look up benzocaine on your computer and just try to go to one of the search engines and see what you can find out of what's in it. I don't believe that there's any type of steroid in there, though.
Okay, thank you.
You got it.
Penny, thanks for calling in. Have a great evening.
You too.
Thank you so much. All right, we're going right back to the lines right now, and Barbara's on the line with us. So, Barbara, good evening, and we're glad you're watching. Do you have a question or comment for Dr. Horwat?
Yes, I have a question.
Okay.
I'm 55, and I just had lost my first tooth. I've always had good teeth, and it was because it got cracked on some food. Very back tooth. And tried to use laughing gas, and I had to get off of that real quick because I felt like my heart was coming out of my chest. And they pulled that off, and then they used the numbing agent, and it was just making me sick. Anyway, he had something something new that he used, and finally got me numbed up, and that was the worst. He was a great dentist, but that was the worst experience I've ever had in my life, to have that tooth pulled. And I've got another tooth that's cracked, and I know I'm going to lose it, and I don't want to have to lose my tooth, but if it's cracked bad enough, they can't save it. Now I'm so scared, I'm just petrified to go back to take care of this. I was wondering if there's any other option other than laughing gas and Novocaine or that they use. Is there anything else that they can give me to take care of this? Or
there is. There's different types of oral sedation they can do as well. We give out something called Halcyon. We give out things, Valiums as well. If a patient is a little bit anxious, I usually have them take a Valium the night before, and then a Valium about an hour before the procedure. And you get a nice general dentist. We can usually make it. I don't know if your concern is you're concerned about the pain involved in it, or if you're just a little bit anxious, apprehensive with regard to the type of procedure you're having done. So I don't really know where your concern lies. But you can always go through oral sedations. They do work very, very well. Dr. Stanley and I do a handful of cases with that if we need to do it. You can also go under general anesthetic if you like as well, or IV sedation, to where they can completely knock you out. If you are going to have one tooth removed, I really would hate to see you have to go the general anesthetic route. It's kind of expensive to be put under. and you're probably going to pay more money to have that anesthetic, to be under general anesthesia than you are to have the tooth removed. But you know, if that's what you have to have, it's what you have to have. I mean, I've done plenty of root canals under general anesthesia as well. But check into oral sedation. If your dentist doesn't have it, mention it to him or her, and I'm sure that they're going to want to accommodate you and want you to be comfortable.
Okay. Thank you, doctor.
You got it.
Thank you, Barbara. We appreciate you calling in. All right, we're going right back to the line. So I think Roy is on the line with us right now. Roy, good evening. Do you have a question or a comment for Dr. Horwat?
Yes, sir. I got a question.
All right.
I'm a diabetic with a bad heart, and I've got 3 teeth that's broke down in my gum, and my doctor told me I needed to have them pulled out so they won't get infected and go to my heart. And I just draw Social Security, and I wonder if he knew of anybody that would help me.
You know, you may want to consider even going to the hospital. I don't know if you're uncomfortable or not, but if you told them you were uncomfortable, they're likely to see you in there, and someone's likely to accommodate you. I think we have a really good 911 system here in our country and a really good emergency room system. If you do go to the emergency room, legally, somebody does have to take care of you. And if they have to remove the tooth, they will. There may not be a dentist there at the time. You might have to wait 4 or 6 hours before anyone will see you as well. I don't know how inconvenient it'll be for you. I know
I've got to go tomorrow to the hospital and have my foot lanced. It's got an infection in it, and it just seems like it's one thing after another.
Yeah, that's unfortunate. You know, it seems that when it rains, it pours. You know, unfortunately, but I know that a lot of times when I'm on this show, just about every time I'm on the show, people ask me that question, and I always refer people out to what's called the Interfaith Clinic.
Faith Clinic.
Interfaith, yep, INTER, faith, and hopefully we can get a number for you on the Interfaith. But the Interfaith Clinic, find out where they're at. They help people that are.
I called that Hope Smiles. They do it, but since I lived in Cheatham County, I wasn't in the metro district. So I just lived like 3 miles outside the county line, but they couldn't do it because I lived in Cheatham County.
Well, that's unfortunate for sure. But check into the Interfaith Clinic. I would highly encourage you to get something scheduled before they start hurting you.
Yes, I've had, the longer I wait on them, the more they crack open.
Yes, sir. Yeah, I'd get moving on it as fast as you can. When you go to the hospital tomorrow, bring it to someone's attention, you know, and I don't want to encourage you to go to the emergency room or anything like that, but if that's what you have to do to have these things removed, it's what you have to do.
Yes, sir.
But, you know, I would also check into, if you have to have them removed, you know, you could probably find multiple dental offices around that will at least give you an exam and x-rays at no charge or at minimal charge.
Yes, sir. We tried to call some people, and they want, if it's broke off down in the gum, they want a minimum of $300, and I mean, I don't have that on Social Security.
No, and also too, if they're broken down, depending on how far they are below the gum line.
Yes, sir.
Sometimes
I know a couple of them down in there pretty good. I don't know how they'll get them out, but
well, we can always get them out. A lot of times, the general dentist won't have the proper instruments. You know, as a general dentist, you know, we can pretty much do just about everything, whether we're doing periodontic work, oral surgery work, endodontic work. A general dentist pretty much does everything, but every now and then it's beyond the scope of a general dentist, and it might be something that they would have to refer you out to an oral surgeon to as well.
Yes, sir. Well, I sure appreciate your information. You've been a big help to me. I've never thought about doing that. I was in the hospital 5 times last year. I've got a pacemaker keeps going off. I got pneumonia, and everybody up there at that hospital knows me by my first name.
Well, I'm sorry to hear it. I hope you get this worked out.
Well, I sure do appreciate the information, and you guys have a good evening.
Yes, sir.
You too, Roy, and best of luck.
Thanks, sir.
You bet. Very welcome. Line's really busy right now, so we are going to go right back to them. And right now, I think we're going to go to Mary. Mary, thanks for holding. And do you have a question or a comment for Dr. Horwat?
Yeah.
Okay, go ahead.
Yeah, I went to a dentist, and this was my first time going, and I wanted to have my teeth cleaned, and they did an x-ray and explained it to me and said that I would need a deep cleaning.
Well, I'm familiar with that and a little concerned about the deep cleaning, and I told them I didn't want to have that done. Just then I needed to think about it, and but I still wanted to have my teeth clean, but they said no, there would be no need to get your teeth clean if you need the deep cleaning. And I'm concerned that at least a cleaning would help until I get the nerve up to get the deep cleaning or the money up. Wouldn't you think at least a cleaning would be good until I get the deep cleaning?
You know, I can appreciate your standpoint on it, but I also can appreciate the standpoint from the dentist as well. It's a really difficult position to be in as a clinician. We have patients that come in all the time. I did general dentistry for a long time before I was an endodontist, and I've had this scenario, I can't count how many times. And it's really complicated because, number one, you don't really want to offend anybody, and you really want to help them. The dentist is actually correct, unfortunately. You know, the cleaning that you're requesting them to do for you really isn't going to benefit you at all. It's kind of like taking a car that's really, really dirty and taking a bucket of water and just kind of throwing it on the car. You really didn't do anything. You may have gotten off some surface material, but you really didn't clean anything. The bacteria is still going to be stuck to your teeth. Getting a deep cleaning is really unfortunate. I really hated it when I had to tell my patients you have to have this deep cleaning because I knew that whatever dentistry they needed to have done, whatever they need, a filling, it doesn't matter. It's not going to work without that cleaning. Unfortunately. The bacteria will attach to your teeth. I always describe it to my patients kind of like barnacles on a boat. It attaches there. Brushing and flossing won't get it off. You have to have it scraped. They call it a scaling and a root planing. You have to get numbed up. You have to have it done. I don't like it. It can be bothersome for the patient. Normally when they need to have it once, they need to have it done at least a couple times a year. Most insurances are covering it only twice a year, and then it's really expensive. And I hated having my patients have the deep cleaning, and it really puts me in a difficult position. I can certainly appreciate the frustration, you know, I can. You know, and I don't know your specific situation. I haven't seen any x-rays, and I don't know you know, I don't really have enough information to know, but if you do need the deep cleaning, it is in your best interest to get the deep cleaning. I can appreciate that it might be kind of expensive for you, but by them giving you a regular cleaning, you know, it really isn't going to benefit you much. If you were in my office in Maryland, I probably would have told my hygienist to go ahead and give you the cleaning because your insurance is covering it. And I probably wouldn't have, I would have tried to avoid the conflict, for lack of better ways of putting it, just to be perfectly honest with you. But I would have probably given you the cleaning, and I would have encouraged you to get the deep cleaning because it is in your best interest to get it, unfortunately.
Okay, hope that helps, Mary. We appreciate you calling in this evening. All right, we are going to take a break. A lot of you on the line with us. I know there's a lot of questions when it comes to your mouth, your teeth, your gums, root canals. So if you do have a question or a comment, give us a call, 737-7587. We are going to take a break and more on Open Line right after this.